This is White. My name is Brianna Harvey. I'll be helping with your care today. How are you doing?
Oh, I'm doing okay, I guess. I've been better.
What's going on? What brings you into the clinic today?
Well, I'm here because I've had left knee pain and swelling for the past week.
How does this kind of affect your daily life?
Left knee pain and swelling for the past week?
Yeah.
Okay. Is the pain still going on currently?
Yeah, I guess, let me tell you the backstory. So, about 2 to 3 hours after I left work a week ago,
Okay.
my kneecap swelled up and was very painful. It hasn't gotten any better, maybe just a little worse.
Okay, so 2 to 3 hours after you left work,
Yes,
your knee swelled up?
my kneecap.
Your kneecap swelled up. And you said it hasn't gotten better?
Definitely not, maybe even a little worse.
Okay. Initially, what were you doing right before this happened?
Well, I've been on my knees a lot during the day, more than usual. Scrubbing floors to get ready for an open house at school.
Okay, so you've been on your knees a lot. How long are you on your knees?
Oh, there's a lot of floors in that school. I feel like all day I've been on my knees.
Okay. So what about, does anything relieve it? Relieve this pain that you're having?
Well, I've used ice several times, and
Okay.
that helps, but it doesn't completely relieve. I tried ibuprofen, and that helped too.
Okay. How much ibuprofen did you take?
I took 2 tablets, so
Okay.
400 milligrams,
Okay.
3 times for the past 2 days.
Okay. And you said that helped?
How about your mother?
A little bit, but
Okay.
again, it didn't completely relieve it.
Okay. And what makes it worse?
Any pressure on my knee is very painful. Bending the knee is really uncomfortable.
How my grandpa eats. He's
Okay.
potatoes kind of guy.
Okay.
He's on the plumper side.
And what would you describe the pain?
Okay, but they're both alive and healthy.
Well, I guess I would say, I don't know. On a scale of 0 to 10,
No, I mean like the quality of it. Is it sharp? Is it stabbing? Does it ache?
oh, it aches all the time. And then if I bend that knee or put any pressure on it, it's like a sharp pain.
Okay. And after when you bend it, you get a sharp pain. When you straighten it, does the sharp pain go away?
My dad's dead.
Oh, it takes a little while, but it hurts to straighten it too.
Okay, it hurts to straighten it as well.
I think he was like,
Okay. Okay. Let's see. And can you said your left knee, you have left knee pain. Specifically where on your knee are you having this pain?
I would say like right on my kneecap.
Okay, so directly on your kneecap.
Yeah.
Okay. Does this pain radiate anywhere else?
No.
So, around your knee, are you having any swelling, tenderness?
Swelling.
Okay, what about tenderness?
Yeah, it's tender.
And do you notice that it's reddened at all?
I haven't noticed any redness.
Does it feel warm?
I haven't noticed.
Okay. And on a scale from 1 to 10, how would you rate your pain? 10 being the worst pain you've ever had.
I would say it's a 4.
A 4? Okay. Have you had any recent fevers or any
No.
fevers, chills?
No.
How about your walking? Are you able to walk at all?
I mean, it's a little uncomfortable, but I can walk.
Okay. Do you exercise?
No, I mean, I walk a lot at work, walking around the school.
Okay.
But besides that, I don't really get much exercise.
Okay. When is the pain worse? When is it at its worst? Is it like do you notice in the morning when you get up it's not as bad, and then as you go throughout the day with movement it gets worse, or when you sit does it hurt a lot because you're bending?
Yeah, I'm kind of stiff in the mornings.
Okay.
So that kind of hurts.
Okay.
And then, yeah, anytime I bend it or put pressure on it, that's when it hurts during the day.
Okay. Okay. And you said it doesn't radiate anywhere.
No.
Okay. Alrighty. So just want to go over this with you. I do have another question about what you use to relieve it. After you take the ibuprofen, you said you're at a 4. Does it help your pain go down at all?
Maybe to a 3.
Maybe to a 3. Okay, so it decreases your pain to a 3. Okay, and you don't exercise, and you said that recently being on your knees a lot at work, basically all day, has initiated this pain.
Yeah.
In the past, have you had any problems with your knees?
Well, my knees ache sometimes. My doctor told me 5 years ago that it was arthritis.
Okay. Okay. Have you been seen since then for your arthritis?
No.
I thought you were still getting ready, and then I was like, wait, I think it's not going to be.
Okay. Okay, I would like to go ahead and ask you some questions about your family, okay?
Okay.
This will kind of just give me an idea of some of the risk factors that you that may increase your likelihood of getting a disease or a disorder. Okay, so your grandmother, your mother's mom, any history of cardiovascular disease, hypertension, respiratory disease, kidney disease?
No.
No? Okay. What about your mother's father, your grandfather?
He's dead.
He's dead. Okay. What age did he die?
I think like 81.
And what was his cause of death, if you don't mind me asking?
I think it was prostate cancer.
Okay. Did he have any other disorders or diseases that you know about?
Not that I know of.
Okay, thank you. So now we're going to be talking about your father's dad, so your grandfather. Do you know of any disorders, diseases, hypertension, cardiac,
I don't
kidney
know of
disease?
any.
Okay.
Nothing significant, anyways.
Okay. And what about your father's mother? Does she have any history?
She's dead too.
Okay. And how old was she when she passed away?
I think 89.
And what was her cause of death?
Colon cancer.
Okay. Okay. And as far as your grandparents, would you know if any of them had gout, osteoarthritis, any osteoporosis, rheumatoid arthritis, or scoliosis?
No.
Okay. Now, let's talk about your parents. Your mom, does she have any chronic diseases, any acute diseases?
She has osteoarthritis.
She has osteoarthritis. Okay. And how old is your mom?
Oh boy. She's like 79.
79. Okay. Alrighty, and she doesn't have any other diseases that you know about?
No.
Okay. What about your dad?
He's passed away.
Okay. At what age did he pass away?
He passed away at 75.
Okay. And what was his cause of death?
He had a heart attack.
Okay. Now, your parents, did they have any history of gout, osteoarthritis, osteoporosis, rheumatoid arthritis, or scoliosis?
Just my mom.
Your
Just
mom.
The osteoarthritis.
Okay. Now, do you have any children?
No.
Okay. Do you have any brothers or sisters?
I have one sister.
Okay. And does your sister have any disorders, diseases that we should know about? Hypertension?
She has osteoarthritis too.
She has osteoarthritis. Okay. And how old is your sister?
She's just 2 years older than me, 52.
Okay. Okay. So just kind of want to clarify why you're here today in the clinic, okay? Mm-hmm. You've come in with some left knee pain and swelling that has occurred over the past week.
Yes.
This occurred initially 2 to 3 hours after you left work.
Yes.
Okay, you noticed that your kneecap was swelling?
Yes.
And it hasn't gotten any better?
No.
Just a little worse?
Right.
Okay. Some changes that have been going on is that you've been on your knees a lot all day.
Yes.
Okay. And this is in preparation for...
Well, I'm a janitor, so
Okay.
I've been having to scrub the floors because I'm getting ready for an open house at the school.
Okay.
It's got to look clean and tidy.
Okay. I gotcha. And you said you've used ice and it helps?
Yeah.
Okay, now, when you say that it helps, what does it help with? Does it take the edge off? Does it relieve the pain?
It just relieves a little bit, but not completely.
Okay. You take the ibuprofen, 2 tabs, 400 milligrams,
Yes.
and it decreases your pain to a 3.
Yes.
Okay. Let's see. You said that any pressure on your knee, especially bending, causes a lot of pain and will trigger your pain.
Yes.
Okay. And that you note that it aches all the time and especially painful to bend or straighten your knee.
Right.
Okay. It's not radiating anywhere other than the tenderness and swelling. Any other symptoms that I should know about?
No, nothing else besides the pain and swelling.
Okay, perfect. Okay. Well, I would like to go ahead and do a physical exam on you, okay?
Okay.